Should I get flexible or rigid cystoscopy? When it comes to examining the bladder, choosing between a flexible or rigid cystoscopy depends on your specific needs and comfort. Both procedures are common tools for diagnosing and managing bladder issues, including bladder cancer. Understanding the differences can help you make an informed decision with your healthcare provider. Flexible cystoscopy involves a thin, bendable tube that is gently inserted through the urethra into the bladder. Because it is flexible, it tends to cause less discomfort and can often be done under local anesthesia, meaning you stay awake. Many patients find it more tolerable, especially since it causes less pain and reduces the risk of urethral trauma. It is usually performed in an outpatient setting, so you can go home shortly after the procedure. Flexible cystoscopy provides a good view of the bladder lining and is ideal for routine checks or initial evaluations of bladder symptoms. It is also suitable for patients with mobility issues or those who cannot comfortably assume the typical position required for other procedures. Rigid cystoscopy uses a straight, metal instrument that is larger and less flexible. Because of its size and rigidity, it often requires general or spinal anesthesia to keep you comfortable during the procedure. Rigid cystoscopy offers superior optics and allows the use of larger instruments, which is especially helpful if a biopsy or treatment of bladder abnormalities is needed. It provides excellent visibility and access for procedures like removing tumors or treating bladder lesions. However, it can be more uncomfortable and is usually performed in a hospital setting. From a bladder cancer perspective, flexible cystoscopy is highly effective for detecting tumors and is comparable in accuracy to rigid cystoscopy. It is often used for initial diagnosis and routine surveillance because it is less invasive and better tolerated. If an abnormality is found, a rigid cystoscopy may be necessary later on to perform biopsies or treatments, as it allows for more extensive intervention. Patient comfort is an important factor. Studies show that flexible cystoscopy tends to be better tolerated, especially in men, due to the anatomy of the urethra. Women generally tolerate both procedures well, but flexible cystoscopy still tends to cause less postoperative pain and blood in the urine. This can encourage patients to adhere to regular follow-up exams, which are crucial in managing bladder health. Cost is another consideration. While rigid cystoscopes are less expensive to purchase, flexible cystoscopes may be more cost-effective overall because they involve less patient discomfort and fewer complications, leading to quicker recoveries and less need for additional treatments. In summary, if your goal is diagnostic evaluation, comfort is a priority, or you have mobility limitations, flexible cystoscopy is usually the best choice. If the procedure involves biopsies or treatment of bladder abnormalities, rigid cystoscopy might be necessary for better access and visibility. Always discuss your individual health situation with your urologist to determine which option is best for you. Both procedures are safe, effective, and important tools in maintaining bladder health and managing bladder cancer. Remember, your healthcare team can guide you toward the most appropriate choice based on your specific needs.